So here, this is a case study. Mr. X or Mr. D, 19-year-old student, has been brought to the emergency department by his roommate, okay, who is a medical student. The roommate is a medical student and family friend. Mr. D reports abdominal pain. That means the patient reports abdominal pain, polyuria, vomiting, and thirst. Okay. He appears flushed and his lips and mucous membrane are dry and cracked. Okay. His skin turgor is poor and he has deep, rapid respiration. And there is a fruity odor to his breath. He has type 1 diabetes and has skipped a few doses of insulin because of craving for finals. It's a very busy time for exam, final exam. He's alert and conversant. That means he can talk, he's alert, but he's having trouble focusing on the nursing question. When you ask some question, he has some trouble focusing on the question. Okay. So please read it again, understand. This question, situation മനസ്സിലാക്കണം. Okay. ഇവിടെ 19-year-old student, 19-year-old with a type 1 diabetes. He was brought to the hospital by his roommate. And the roommate is medical professional. Okay. And the patient had abdominal pain, polyuria, vomiting, thirst. On examination, he become flushed, lips and mucous membrane and dry and cracked. Dry and cracked lip, that is indicating dehydration. Skin turgor is poor. That means he has dehydration. And he has deep and rapid respiration and there is a fruity odor to his breath. Fruity odor respiration, it is indicating Kussmaul's respiration. Clear, ayo? And the patient says he is diagnosed with a type 1 diabetes and he has to take insulin, but he missed a few doses of insulin. What he is supposed to take, he did not take the medicine. Okay, കുറച്ച് ദിവസമായിട്ട് എക്സാമിന്റെ ബിസി ആയതുകൊണ്ട് ആള് മെഡിസിൻ എടുത്തില്ല. ആള് alert ആണ്, he is alert and conversant, but he has trouble focusing the question. Situation clear ayo? Question situation clear ayo? Yes?
Yes.
Okay. So what is the condition here?
Diabetic ketoacidosis.
Perfectly all right. Diabetic ketoacidosis. Okay. Any vital signs and blood sugar level? You can just read it. Blood sugar level high and respiratory rate is high and heart rate 120. Just remember this. Okay. Temperature elevated. Vital parameters? Fine. Okay. Next. ഇനി ഈ സെയിം സിറ്റുവേഷൻ ബേസ് ചെയ്തിട്ടുള്ള കുറെ ക്വസ്റ്റ്യൻസ് ആണ് ഞാൻ പറയാൻ പോകുന്നത്. നമ്പർ 1, to clarify pertinent data, what question are appropriate to ask to Mr. D? That means when you get to this particular same kind of a patient, what question you will ask? Okay, അതായത് എന്തിനു വേണ്ടിയിട്ടാണ്? Why to ask question? To gather data. To which the data has to be having some relation with the disease. And what is the current diagnosis of the patient?
Diabetic ketoacidosis.
Diabetic ketoacidosis. Okay, perfect. So, നിങ്ങൾ answer പറയൂ. ഏതൊക്കെ question വേണമെന്ന് പറയണേ. If you want to keep the answers, you can tell me so. Otherwise, I will just remove it. Fine. 1. First question. When did your symptoms start? Do you want that?
Yes.
When did your symptoms start?
Oh.
Yes.
Yes. Okay. Second, how many times have you vomited? Dehydration, Anna?
Yes.
Yes.
When were you diagnosed with diabetes? When were you diagnosed? എന്നാണ് നിങ്ങൾ diabetes?
No need.
No need. No need.
Okay, not necessary. Close. And where does your abdomen hurt?
Yes.
Do you want to see the signs and symptoms again?
Abdominal
Yes.
pain.
വേണോ?
Yes.
ഇവിടെ again, yeah, നിങ്ങൾ സയൻസ് വേണമെങ്കിൽ ഒന്നുകൂടെ നോക്കിക്കോ എന്തൊക്കെ സയൻസ് ആണെന്നുള്ളത്. Dehydration, പിന്നെ polyuria, abdominal pain, vomiting, thirst, the small respiration. കിട്ടിയില്ലേ? So abdominal pain allowed, definitely patient has pain. What we need to do is we have to locate the pain, right? Yeah. Okay. Appo idu veno? Fourth one veno?
Yes.
Fifth one. Did you take insulin today?
Yes.
Yes, few days skip
Skip ആയിന്ന് പറഞ്ഞിട്ടുണ്ട്. അവര് ചോദിച്ചത് ഇന്നിപ്പോ ഇൻസുലിൻ എടുത്തോ?
Did you take
Currently, അപ്പൊ അത് വേണമല്ലോ. Do you have any allergies?
Yes.
Yes.
Yeah.
Yes.
Yes, this is like on admission, usually we select all these questions. So what not to ask? Third one is not related to gather the data. Rest all options are necessary. So the answer for this question, this sub question is other than 3, all 1, 2, 4, 5, 6.
4, 5, 6.
Okay. Next. The nurse has completed. Any doubt?
No.
Okay. The nurse has completed the triage assessment and history taking. Now, what is the priority action? See, this is all talking about the same Mr. D. Okay, നമ്മളത് പറയുന്നത് Mr. D യെ കുറിച്ച് തന്നെയാണ്. If you want to see the Mr. D situation, you can ask me so that I can say. So, ഇവിടെ triage assessment completed. You have to just visualize the entire thing. Patient got and patient is there in the casualty. And you asked, you collected many data and then you assessed the triage assessment, history completed, and what is the next priority action?
Take the client immediately to treatment room.
Option 1 is page into emergency department healthcare provider to come to the triage. Veno? Where is the patient? Where is the patient right now?
Patient in emergency department.
Emergency department. So it is not necessary to call the doctor again. There will be doctor here, right? Okay. Second one, call the client's parent for permission to treat.
No need.
No. Okay. Notify the client's primary healthcare provider.
No need.
No need.
No need.
For-
Take the client immediately to the treatment room.
Yes. Yes. Yes.
Okay.
Yes.
Okay. Perfect. Fourth one is the answer. Another question. Clear ആയില്ലേ?
Yes, ma'am.
This is talking about Mr. D. What is the priority nursing concept to consider in planning the initial emergency intervention for Mr. D? Okay, so in Mr. D in manage, what is the first nursing concept to consider? So this is an emergency treatment, right? So what you have to think about the first concept: gas exchange, acid-base imbalance, fluid and electrolyte balance, and adherence.
Fluid and electrolyte imbalance.
Okay, fluid and electrolyte imbalance. Why?
Dehydration.
Dehydrated, the patient vomits and thirst. He is thirst. So his lip is everything is dried and cracked.
So currently the patient is at a phase of dehydration. So basically in dehydration, we have to think about fluid and electrolyte balance. So we need to start fluid immediately. We need to start in fluid immediately, and sugar level is high. So since the sugar level is high, we have to give insulin as well. Okay. Clear are you? എന്തെങ്കിലും doubts ഉണ്ടോ? What was the sugar level? How much it was?
685.
685.
In this case, hypertonic solution.
Yes. പറയൂ. Someone asked.
ഡികെന്റെ കേസിൽ
എന്ത് fluid ആ
hypotonic
കൊടുക്കുന്ന?
hypotonic.
Isotonic solution. R11. Next. Which task are appropriate to delegate to experienced, unlicensed, assistive personnel? Select all that apply. അതായത് ഈ സെയിം മിസ്റ്റർ ഡിയുടെ കേസിൽ തന്നെ കുറച്ചധികം ആക്ഷൻസ് പറയുന്നുണ്ട്. ഇതിനകത്ത് ഏതാണ് അൺലൈസൻസ്ഡ് അസിസ്റ്റീവ് പേഴ്സണലിന് കൊടുക്കാൻ പറ്റുന്നത്? Please carefully read and select. One is measuring and reporting Mr. D's vital signs. And second is checking and reporting Mr. D's blood sugar level every 15 minutes. Bagging and labeling Mr. D's belongings. Updating the roommate regarding Mr. D's status. Measuring emesis and cleaning the basin. Obtaining an infusion from the supply room. Select it. If you don't want to give, that can be removed. First one, Venam. Measuring and reporting vital signs. Do you want that?
Yes. Yes.
Yes, Venam. Okay. Second one.
No. Checking.
Second one, Venam.
No.
Checking and reporting blood sugar level check check 15 minutes.
Every
Blood sugar level check Venam.
No. No.
First one is required. First one, okay, one. Why second one is wrong?
Every 50 minutes.
Assessment is nurse's responsibility.
Assessment is an registered nurse responsibility. Is that?
Yes. Yeah.
Okay. Any third one?
Bagging and labeling Mr. D's belonging. Yes.
Yes.
Can be, right?
Yes.
Okay. And fourth one?
Updating the no need.
Fourth one?
No.
Updating the roommate regarding Mr. D's status. Adu venam?
No.
Okay. Fine.
Fifth one, measuring
Fifth one,
emesis.
measuring emesis and cleaning the basin as needed.
Yes. Yes. Yes.
Yes. And obtaining the infusion pump from the supply room.
No. Yes.
The infusion pump
yes.
എടുത്തുകൊണ്ട് വരുവാന്നുള്ളതല്ലേ?
Yes. Need.
Okay, sixth one.
Yes, ma'am.
Okay.
Fifth one is okay. And what about fourth one?
The fourth one is updating the roommate regarding Mr. D's
I think
status.
better. Fourth one should be R11.
Yeah, fourth one venam.
Random, ma'am. We
Why?
can remove.
Why?
So, here regarding status, unlicensed assistive allalo parayande.
Okay, so the prognosis regarding an updation, he should not tell. Sorry, she should not tell. He or she. Fine. So D is wrong. Bagging and labeling can be, right?
Yeah, it can
And
be.
what about second one? Checking and reporting Mr. D's blood sugar every 15 minutes.
15 minutes.
Can be possible.
No, it's not.
Read the option
Checking and
carefully.
reporting. Yeah. Yes. Checking and reporting Mr.
Reporting
D.
to whom?
Reporting to the registered
Reporting to
nurse.
you. Yeah,
Yes.
reporting to registered nurse. So
Yes.
this can be performed right now. Because
Yes.
where are you now? You all are there in emergency department and UAP is at their emergency department. Mr. D is also there in the emergency department. So here just going and just pricking here and checking the blood sugar and reporting to the registered nurse. That is perfectly all right. Okay. But assessment and evaluating something should be done by registered nurse. Here, she is going and checking the blood sugar and coming and reporting to the registered nurse. So it is perfect. And only the progress regarding the patient is not allowed him to explain. Clear? മനസ്സിലാവുന്നുണ്ടോ? അതായത് ഇത്രയും ഓർത്തിരിക്കണേ, ഫ്രീക്വന്റ് ആയിട്ട് ഇവാലുവേറ്റ് ചെയ്യുന്ന എന്തെങ്കിലുമൊക്കെ കാര്യങ്ങൾ. ഇപ്പൊ ബ്ലഡ് ഷുഗർ എവറി 15 മിനിറ്റ്സിൽ എടുത്തിട്ട് അത് ഇവാലുവേറ്റ് ചെയ്യുന്നത് രജിസ്റ്റേർഡ് നഴ്സ് ആണ്. പക്ഷെ ഇവിടെ വളരെ കൃത്യമായിട്ട് പറഞ്ഞിട്ടുണ്ട് ചെക്കിംഗ് ആൻഡ് റിപ്പോർട്ടിംഗ്. ഓക്കെ, ഇഫ് ഇറ്റ് കുഡ് ബി ലൈക്ക് അസസിങ് ബ്ലഡ് ഷുഗർ അങ്ങനെ ആയിരുന്നെങ്കിൽ പറ്റില്ലായിരുന്നു, UAPക്ക് കൊടുക്കാൻ പറ്റില്ല. അവിടെ അസസ് ചെയ്യുകയെന്നാ പറഞ്ഞേക്കണം, അല്ലെങ്കിൽ ഇവാലുവേറ്റ് ചെയ്യുകയെന്ന്. പക്ഷെ ഇവിടെ ജസ്റ്റ് ചെക്ക് ചെയ്യുക ആൻഡ് റിപ്പോർട്ട് ചെയ്യുക. So he can do or she can do. Fine. അടുത്ത question. For the initial emergency care for Mr. D, what is the priority collaborative treatment called? What is collaborative treatment called? Many are coming together and doing. Okay, collaboration like means കുറെ കാര്യങ്ങൾ ഒരുമിച്ച് ചേർത്തിട്ട് ചെയ്യുന്നത്. So in emergency department, what is the collaborative treatment called? Try to remove wrong. First one says correction of hyperglycemia with IV insulin. What do you want? Like whether would you want to keep that? Option 1 വേണോ? Yes.
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 Will keep. Okay. Option 2, correction of acid base imbalance using bicarbonate. Is that the primary
No
goal?
need.
No
No
need.
No.
Will remove.
Need.
Correction of fluid imbalance with IV fluid.
Yes.
Correction
Yes.
of
Yes.
fluid imbalance with IV fluid. Do you want?
Yes.
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 Correction of potassium imbalance with IV potassium.
Yes.
You
Yes.
want?
Yes. Yes.
Okay. And the key. So you kept 3 answers. And the key is initial. He is initial. First step.
Hyperglycemia with insulin.
So this is what is the condition here? It is
Type 1D.
Hype.
Diabetic.
Diabetic
diabetic ketoacidosis. So what is the primary priority emergency management in terms of diabetic ketoacidosis? IV insulin one side and fluid electrolytes balance is another side.
Fluid.
So which one you will give more priority? The primary priority you have to give for fluid. Yeah, you have to, because otherwise the patient could end up with a extreme hypovolemia. So you can immediately start hydration. So when you start hydrating, the fluid get increase, and that helps to remove the ketones, whatever is formed within the body. Definitely you have to start insulin as well, but the priority care what we give for fluid and electrolyte. Okay, clear, Ayo? Okay, another question. In the emergency department of care for Mr. D, which healthcare provider prescription would the nurse question? മനസ്സിലായോ? ഇവിടെ doctor has prescribed how many? 6 order. And which of the prescription would the nurse question? Okay, so you have to select the right prescription or wrong prescription. You have to select wrong prescription. Okay, we'll read. Option 1, if you want to keep, you can keep it. Otherwise, we will remove. Option 1 says, start peripheral IV line with a large bore catheter. Is true or false? We want to select
True.
false, right? False അല്ലേ വേണ്ടേ?
Yeah.
Yeah. So first one will remove. വേണ്ടല്ലോ? Remove ചെയ്യാണ്. ഞാൻ കട്ട് ചെയ്യുവാണിത്. First one cut ചെയ്തു. Second, obtain a urine specimen for a large bore straight catheter. വേണോ?
You can remove.
What is wrong? Why it is wrong?
Madam, small bore ആണ്. Madam, large bore.
Oh, sorry. I read a small, like large bore. Sorry. So if it is specimen, obtain a urine specimen with a small bore straight catheter. Why it is considered as wrong? If we feel this is wrong, then why? Yes. വേണം, അത് ട്രൂ ആണ്. Yes. അല്ല, ഈ രണ്ടാമത്തെ ഓപ്ഷൻ ശരിയാണോ? യെസ്, യൂറിൻ സ്പെസിമെൻ വേണം. വേണം. Okay. With a small bore straight catheter. See, you can ask the patient to collect the urine in sitting in a commode or something in other method. The catheter doesn't require. Why? Because there may be higher chance to get infection frequently when you collect the urine with the catheter. മനസ്സിലായിരുന്നുണ്ടോ? So second one is halfway it is wrong. So it has to be questioned. And what about third one? Administer regular insulin subcutaneously.
Should be in IV.
It has to be
IV.
given IV.
IV.
So it is a wrong order. Fine. Yes. And fourth one is maintain the clients in a semi-polus position. What do you think?
Yes.
Yes, ma'am.
It's true. Okay, so we'll remove that. And the fifth one, initiate continuous ECG monitoring.
കണ്ടിന്യൂസ് ആയിട്ട് ECG വേണം.
വേണം.
Chance for shock. No?
Okay.
Because
വല്ലപ്പോഴും മതിയോ?
കണ്ടിന്യൂസ് ആയിട്ട്
റാപ്പിഡ് റെസ്പിറേഷൻസ് ഉണ്ട്. പിന്നെ
There may be chances to get hypokalemia, right? When we start treating this particular patient, there may be chances to get hypokalemia, and here there will be chances to get electrolyte imbalance as well. So, അതുകൊണ്ട് basically ECG has to be monitored, but if it is not continuous, but still ECG monitoring is required, and we can't make this order as completely wrong. മനസ്സിലായോ? ഇതിന് നമുക്ക് ഇത് wrong ആണെന്ന് പറയാൻ പറ്റില്ല, പക്ഷെ ECG monitoring definitely it is required even if it is not continuous. Fine. So this is okay.
Maybe there are.
Yeah.
Okay.
Correct.
Correct അല്ലേ?
Correct ആണ്. Order correct ആണ്.
Order correct.
Order is correct. Yeah. And sixth one is encourage intake of oral fluid as tolerated. See, when you read it, you have to understand the meaning. Encourage, you will ask the patient, please drink water, drink lots of fluid. Or avare encourage here. Encourage oral intake.
yes, ma'am.
Is
We
true or
should
false?
True.
True. Because the patient needs to drink lots of water. See how the fluid is replaced.
So answer 4 and 5 will be answer.
ഇവിടെ നമ്മൾ ഓറലി അവരുടെ അടുത്ത് കുടിക്കാൻ പറയുകയാണോ ചെയ്യണ്ടേ? So this is an emergency care. Remember, this is an emergency care. So yeah, you have to start the first IV line ഇട്ടിട്ട് നമ്മൾ എന്ത് ചെയ്യണം? IV fluids has to be started.
Yes.
So that ഇവിടെ 3 wrong orders ഉണ്ട്. One is urine specimen through a small bore straight catheter where catheter doesn't require. Third one is administer regular insulin subcutaneously. No, subcutaneous doesn't require. IV required. Again, oral fluid, not oral fluid. It is IV fluid, IV fluids, or like hydration. Okay. And one more. Next, what does the nurse anticipate the healthcare provider will order for the initial fluid replacement? ഇവിടെ ഏത് ഫ്ലൂയിഡ് കൊടുക്കും എന്നാണ് നമ്മൾ വിശ്വസിക്കുന്നത്? ഏത് ഫ്ലൂയിഡ് കൊടുക്കും എന്നാണ്? Recently, I think Faisal has asked this question. ഏത് ഫ്ലൂയിഡാ കൊടുക്കുന്നതെന്ന്?
Normal saline.
Normal saline with
So isotonic solution. So which one is isotonic from this? First one, first option.
0.9%.
See, these all questions related with the diabetic ketoacidosis in an emergency department. Okay.
The second one also okay.
Second one.
0.45.
That's half strength. It's like a hypotonic solution. We don't give hypotonic solution right now. Normal saline is okay, but half strength NS is considered as a hypotonic solution. We don't give hypotonic solution. Okay.